This is Stephanie Huff, and I'm recording the concept of inflammation. All right, normal presentation. Inflammation is an adaptive response to injury. It's an illness that brings plasma, which is extra fluid, to the area, dissolved substances, blood cells. All of this is brought into the interstitial tissue where damage has occurred. The innate immune response is nonspecific because the same events occur regardless of the cause of the inflammatory process. During the inflammatory process, particulate matter, bacteria, damaged cells, and inflammatory exudate are removed through phagocytosis, and a large number of potentially damaging chemicals and microorganisms can be neutralized. This process is called debridement. Debridement does prepare the wound for healing. Adequate nutrition is essential for inflammation and healing to proceed. Just a little physiology review. These are the 5 signs of inflammation: pain, swelling, redness, heat, and impaired function. Impaired function is usually the body part that is related to the injury, and most of the time this is going to be a severe type injury that causes impaired function. Itis is basically describes an inflammatory process going on. So like for an example, appendicitis would be inflammation of the appendix, gastritis, inflammation of the stomach. Alright, so your injurious agents: physical, these include mechanical objects causing trauma to tissues, excessive heat or cold, and radiation. Chemical, these are external irritants like strong acids, alkalis, poisons, irritating gases. Your internal irritants are substances manufactured within the body, like excessive hydrochloric acid in the stomach. Your microorganisms that cause inflammation are bacteria and viruses. Function of inflammation: it does contain the injury just to that localized area, and destroys microorganisms. This is all just the body's response to that inflammatory process. Alright, so during acute inflammation, the inflammatory process occurs within minutes of an injury, such as a splinter or an insect bite. On the other hand, a response to a bacterial infection may take a few hours for it to occur. During an acute inflammatory process is when you see typical signs of inflammation. That's going to be your redness, swelling, pain, heat, and impaired function. The acute process will continue until the trauma or the infection has been neutralized. If the body is unable to neutralize the harmful stimuli, the response becomes chronic, and then it will continue for months or even years. Chronic inflammation ranges from seasonal allergic reactions to pollen to responses that damage healthy tissue and autoimmune diseases. Alright, so there are different stages of inflammation. In stage 1, the vascular and cellular responses: immediately after an injury or an infection, the blood vessels will temporarily constrict in the surrounding area. The injured tissue will release histamines, kinins, prostaglandins in response to this injury or infection. These substances will serve as chemical mediators, and they will dilate the blood vessels, causing more blood flow to the area. The increase in blood supply is referred to hyperemia and gives the classic redness and heat that accompanies inflammation. Looking at the vascular permeability, it increases at the site with the dilation of vessels. Then you will have fluid proteins and leukocytes, which are white blood cells that leak into these interstitial spaces. This causes inflammatory swelling and pain. Fluid can affect the body and organs according to the area. So if it's in the joints, this excessive fluid can cause decreased range of motion. It can also occur in the pleural area as well as the pericardial cavity. Slowed blood flow in dilated vessels brings more leukocytes to the area. These leukocytes will then aggregate or line up on the inner surface of the vessel. This is known as margination. Leukocytes then move into the affected tissue spaces. This is known as emigration. In response to the exit of leukocytes from the blood into the tissues, the bone marrow will then produce more leukocytes to release into the bloodstream, and this will show up as leukocytosis on your blood work. Typical injuries that people seek treatment for are going to be sprains, fractures, minor blunt force injury. That could be like just two kids running into each other at a playground. All right, now on to stage 2 of the inflammatory process. During stage 2, exudate is produced. Major types of exudate are serous. This typically accompanies mild inflammation and is clear or straw-colored with a thin, watery consistency. Your purulent exudate is opaque or milky. It is commonly referred to as pus. It normally indicates an infection and contains large quantity of cells and necrotic debris. Your hemorrhagic is also sanguinous, that's how it's described. Contains blood from ruptured blood vessels. It is red and thick. Stage 3 involves the repair of injured tissues by regeneration or replacement with fibrous tissue. This is also known as scar formation. Regeneration is the replacement of destroyed tissue cells by cells that are identical or similar in structure and function. These cells are replaced one by one until the function of the tissue is restored. Some are more elastic and flexible than others when the repair is completed. When regeneration is not possible, repair occurs by fibrous or scar tissue formation. In the early stages of this process, the tissue is called granulation tissue. It is a fragile, gelatinous tissue that appears pink or red because of the many newly formed capillaries. Later in the process, the tissue shrinks, and this is when the capillaries constrict. Sometimes they're even obliterated, so they're just kind of cut off completely from circulation. And collagen fibers contract. This leaves a firmer, fibrous tissue. It is called cicatrix, it's cicatrix, or scar tissue. All right, so you will have a release of these mediators from inflammatory cells, and these are things such as macrophages and mast cells. Mast cells are leukocytes that are found in most body tissues. One of the principal sources of cell-derived mediators of inflammation includes histamines and heparin. In response to the injury, histamine and heparins will work together to increase blood flow to the injured site. Histamine will cause dilation of nearby blood vessels and increase their permeability, and then heparin comes in to help prevent the blood from clotting. There are 4 types of histamine receptors, and they are called H1, H2, H3, and H4. Your H1 and H4 are involved in the inflammatory process. When a patient is exposed to an allergen that results in a rapid release of inflammatory mediators, anaphylaxis will occur. If it is untreated, it can lead to death. All right, and so this is a nice little picture just describing the cellular injury, the release of the mast cells, and basically kind of what happens. This picture is also in your book on page 635. All right, so some genetic and lifespan considerations. There are several differences in anatomy, physiology, influence that affects the inflammation in adults versus kids. So pediatric population tends to have a smaller airway, so they have an increased risk for obstruction, especially when they have airway inflammation. Children also have fewer and smaller alveoli available for gas exchange. The increased energy that's needed to achieve adequate oxygenation during airway inflammation may lead to fatigue and respiratory failure in infants. The glomerular filtration and the kidney's ability to dilute and concentrate urine is not fully developed in infants, so the renal system basically can't compensate as well with the fluid fluctuations that occur during the inflammatory process. And because of their small size, absolute volumes of fluid loss represent a larger proportion of total body fluid, because kids, they have a lot more, their body is made up a lot more concentration of water than adults, so they're a lot more sensitive to these changes in fluid loss. Alright, so basically while adults typically respond to hypovolemia with compensatory increase in heart rate, tachycardia is often a late symptom of hypovolemia in children, so you want to figure this out before that happens. The gastrointestinal inflammation reduces nutrient absorption. This affects kids greater than adults. Kids have a higher metabolic rate and generally less stored fat, so decreased absorption of these nutrients has immediate detrimental effects on not only their growth, body weight, energy levels, but bone and muscle strength and their overall health. Infants are less able than adults to produce anti-inflammatory mediators, so that's all often a bad combination as well, and usually leads to infection faster. Alright, alterations can occur in any tissue, organ, or system in the body. These are some of your common disorders that you'll see. We're not talking about all of these at this point in the program, but you can see on there your SLE, that's your systemic lupus erythematosus, and then of course RA is rheumatoid arthritis. You've also got lots of others that are not just disease processes, but it could be like allergic rhinitis, anaphylaxis, contact dermatitis, arthritis. There's lots of other ones that may occur as well, and there's a big old list in your book. I just listed some of the main ones. Alright, so we have talked again. Your classic signs are going to be redness and swelling. Healthy inflammatory response includes activation and recruitment of those white blood cells to the affected site. Your localized responses are limited in terms of which sites are affected. Generalized responses can affect the entire body. Looking at prevalence, basically just different disease processes have different prevalence. Like rheumatoid arthritis, typically onset is middle age with increased incidence among older adults, but it can also occur in children and young adults. It's like 1.3 million people in the United States, specifically adults, have rheumatoid arthritis, and then 8.2% of the U.S. population has asthma, so it's a little bit bigger. Millions of adults and kids in the United States have some type of inflammatory disorder. Alright, so some of your non-modifiable risk factors. Your Native Americans or Mexican Americans tend to have an increased risk for gallstones. Family history and female gender also plays a risk for gallstones. Your African Americans are more likely than Caucasians to develop nephritis as a result of lupus. And then family history is associated with peptic ulcer disease. Peptic ulcer disease, also diet is a modifiable risk factor, and there are also some other modifiable risk factors that are typically involved that can cause peptic ulcer disease. All right, so these are different concepts that are related to inflammation, and these are found in your book on 638. There's a table that has the relationship of these to the inflammation and nursing implications. There's also a really good table on the next page, 639, that has alterations in therapies and inflammation, and just kind of goes through like definition and treatment and that kind of thing. But infection, basically these are just your stages in the infectious process. Immunity includes your hypersensitivities. Oxygenation, your oxygen, looking at the oxygen assessment. Do they have a history of ARDS, which is acute respiratory distress syndrome, asthma, COPD, RSV, bronchiolitis. Your teaching and learning, this is going to include your client and consumer education. Of course, prevention, you want to avoid known triggers. Triggers could be dust, pollen, animal dander. Food triggers are especially important with inflammatory bowel disease or peptic ulcer disease. Hand washing is the primary method of preventing infection that can result from inflammation, so that's important. And these are just some modifiable risk factors for a couple of the different inflammatory diseases. Crohn's disease, diet low in refined sugars, need to increase fiber intake, and quit smoking. Gallstone formation, need to maintain an appropriate weight. Diet should be high in fiber, low in fat. Avoid rapid weight loss. So a lot of these risk factors that are modifiable will differ according to the disease process. All right, so some of your risk factors for nephritis are going to be diabetes, hypertension, overuse of NSAIDs, and drug abuse. And again, all of these can be modifiable, whether with weight control for your hypertension and diabetes. A lot of times changing the diet can help, or they may even have medications that will help control those disorders. Sorry, I got a little ahead of myself. All right, so screening acute disorders with inflammation is usually not possible. There is no screening test for those. Skin testing will identify the allergens that they are sensitive to. Your TSH is your thyroid stimulating hormone, is a test that can be used for Hashimoto's thyroiditis, which is an autoimmune disorder that triggers thyroid problems. The goals are going to be early identification and treatment of inflammatory diseases, and this will help to reduce mortality and effective management of the disorder. All right, so when you're looking at your nursing assessment, getting your history, you need to assess the degree the patient is at risk for developing inflammation and any reports that suggest the presence of inflammation already. When you're looking at your physical assessment, looking at any signs and symptoms that they have, and these are going to vary according to the area that's affected. And so sometimes it could be a localized area, sometimes it could be an organ that's infected, or an entire body system. Their widespread inflammation has diverse symptoms. So do they have any physical symptoms of inflammation? Do they have pre-existing conditions that would predispose them to some of these inflammatory disorders? Some of your more widespread disorders, like your nephritis or allergies, they may have more diverse symptoms, and so a lot of times they can be even sort of vague. So you just want to get a good assessment interview. So these are your cardinal signs of inflammation. And so you've got localized signs and symptoms. That's again the erythema, local heat, swelling, pain, loss of function. Your systemic manifestations are going to be a temp that's greater than 38 degrees Celsius, which is 100.4 Fahrenheit, less than 36 degrees Celsius, which is 96.8 degrees Fahrenheit. And then, of course, you've got your heart rate greater than 90 or less than 20, your white count greater than 12,000, or they have greater than 10% bands. Those are your immature blood cells. They have enlarged lymph nodes, loss of appetite, fatigue. Looking at your diagnostic test, your erythrocyte sedimentation rate, or your ESR, C-reactive protein, CRP, those are both inflammatory test markers. So your sed rate measures how far the erythrocytes will settle in a tube over a period of time. It's usually 1 hour. During inflammation, there's an increase in fibrinogen, and this causes the red blood cells to stick together, so they settle faster, so they end up with a higher erythrocyte sedimentation rate. And so you can see your normals for males and female, 0 to 15 millimeters per hour, and for males and females, 0 to 20 millimeters per hour. Your C-reactive protein is a protein that's found in blood. It is produced by the liver and fat cells in response to inflammatory process. In the absence of renal failure, a rise in CRP indicates inflammation. So if they have a history of renal failure, they're already going to have an increased CRP. So you can't base an inflammation process by that if they have renal failure. All right, so other tests that can be ordered are based on cause, location, and type of inflammation that's suspected. So they may get a white blood cell count with differential if they suspect an infection. Your serum protein electrophoresis, this may reveal increased your gamma globulin and decreased albumin, and that will indicate your SLE, which is your lupus. Routine chemistry panels, they are looking at if there's any kidney involvement, any abnormal liver function, different things like that. All right, so looking at interventions and therapies, these are going to be aimed at reducing mobility and edema. So elevation is done to help reduce the swelling. Your antipyretics are given if they have a fever. Anti-inflammatory medications are given just to help decrease that inflammation. Some of your specific treatments, antibiotic treatment, of course, is going to be to treat infections. Surgery, if it's like an appendicitis or a gallbladder disease and they need to remove those organs. Steroids are given for severe systemic inflammation. Right? So we've got some independent interventions that can be done. Nurses should emphasize the importance of preventing further injury. They need to make sure that they're taking their meds as prescribed to treat or prevent the illness. They also need to make sure they're maintaining adequate intake of liquids and nutrients. Family teaching of the patient if the patient needs assistance in dressing changes. A lot of times we have to do a lot of family teaching so that they can change the dressings for the patient. Also preventing exposure of the inflamed area to water while bathing. or any other aspects of daily living until healing occurs. So the teaching is going to be specific to the needs of the patient. So when you're looking at collaboration, you've got chronic inflammatory conditions are often associated with aging and obesity, so they need to make sure that they have a balanced diet, and exercise is going to be important. You can collaborate with your physical therapist, nutritionist to help with their diet as well as exercise. You'll have collaboration with surgeries. For surgeries, you'll be collaborating with the surgeons for that. So again, like they need appendix taken out or gallbladder removed. Your medications, your NSAIDs, this is going to be like aspirin, indomethacin, ibuprofen, naproxen, Celebrex, your corticosteroids. That's like betamethasone, dexamethasone, prednisone, hydrocortisone, and methylprednisone. Analgesics, these are going to be more your narcotic analgesics, hydromorphone, fentanyl, morphine, oxycodone, just to name a few. Some of your natural remedies is going to be fish oil and omega-3. Those both have anti-inflammatory properties to them. And of course, as always, your book has a chart on those. So that's all for the concept of inflammation. If y'all have any questions, as always, please let me know and I will try to help clarify things for you.